Welcome to the podcast, Alexis. I'm so looking forward to getting to know you live along with the listeners.
Thank you so much for having me. I'm excited for our conversation.
Yeah, well, as I said before we hit record, I really like starting with hearing a little bit about people's personal stories. I know for me, when I first learned about intuitive eating in the anti-diet world, I found so much healing in just hearing about other people's stories. So I'd love for you to share your own story with your relationship with food and body as much as you're comfortable getting into.
Sure. Yeah. So, like so much of us, I grew up in diet culture and I grew up in a very diet-centric family. So, I just kind of thought dieting was like totally normal. I went on my first diet when I was 8, like a juice cleanse that was of my own volition. I found it on the back of one of my mom's like many, many diet books that were kept in the family room. And I thought that was, as an 8-year-old, I wanted to be grown up, and I thought that's what grown-ups do. And it lasted about a day, and I just remember going to bed feeling very, very hungry. And one of the first times I really like felt preoccupied with food, really went to bed. I remember like dreaming about what I was going to eat the next day. And, I struggled for many, many years around the idea of just trying to control what I'm eating, trying to lose weight, thinking that was going to make my life better in a myriad of different ways, but always feeling like something was wrong with me, that I wasn't able to stick with it, that I wasn't able to be disciplined enough or motivated enough. And that went on up until I was in grad school, and I really was interested in psychology in large part with the intention of focusing on like weight loss and trying to help people lose weight. And it wasn't until actually like after I graduated grad school, and was out in the world, like starting my private practice and working in research, that I actually started to learn about weight inclusive approaches to health. And it was just like mind blowing.
Yeah. Yeah, I love hearing about that moment for people. What was your first exposure? Do you remember the exact moment that you learned about weight inclusive health?
I do. So I was at a mindfulness retreat, and the retreat itself was like not at all weight inclusive. It was teaching mindfulness, but also encouraging people to like be mindful about cutting out calories and things like that. But there was a contingent of people who were involved in the Health at Every Size movement at the retreat, and it was like a revolt happening against the
Oh my God, wait, I
instructor.
love that. They're like undercover. They're actually trying
Yeah.
to like, that's amazing.
Well, I think so many of us, we signed up for this retreat not knowing what it was. And they were really appalled at the idea that the instructors were like encouraging us to tell our clients to cut calories and to lose weight. And it started the conversation. It's the first time I was ever exposed to that message. And, it was a retreat. Like, so we were all away at this, center in upstate New York. And, so you have a lot of time to just like talk to people. And I was sitting talking to someone over one of the meals, and they just said to me, well, like diets don't work. And I was like, what? Like it was that I would say, it's not that everything changed overnight, but that was a really eye-opening moment for me because that thought had literally never occurred to me.
Mm,
The idea that diets don't work or that this whole paradigm could be flawed. Like I just was so convinced that I hadn't cracked the code yet, that I was doing it wrong. And it was like that, just planting that idea. I was like, oh, wait, that actually makes a lot of sense. And I have literally never thought about that possibility before. So I'd
yeah.
say that's really where my journey started.
What a like record screeching moment in the movie of your life where it's just
Yeah,
like that provider, it sounds like said it so casually, but it was like absolutely like mind-blowing to you.
exactly.
Are you still in touch with that person?
No, I'm not, unfortunately.
Because it sounds like they set off a whole, I mean, you probably would have encountered it eventually. It's like way more popular now, but it sounds like they kind of pushed a domino for your career and your life.
Yeah, for sure. That group of people that I met at that retreat was really transformative. They also told me about the BETA conference, the Binge Eating Disorder Association conference, which was one of at the time, one of the very few really like HAES informed weight inclusive conferences. And I went to the conference that year. And, that also like was part of my journey and deepened my understanding of what this movement's really all about. I wouldn't say I was like convinced overnight. It took some time, but these were all really pivotal stages.
Yeah. Wow. Okay. So then what happens from there till today in like brief spark notes in terms of what does it look like? Were you already practicing as a psychologist when you were at that conference?
Yeah, so I was practicing as a psychologist. I was also working in quote unquote obesity research. So I was very involved in kind of the science of weight. And it was interesting because kind of like I was going through two parallel processes of starting to learn about weight inclusive approaches to health, but also being very immersed in the obesity research world. And the thing that was really convincing was like the data kind of lined up with both. It was just different approaches of how people were like handling it. So I'd go to these obesity research conferences, and inevitably there'd be a ton of talks and research and studies presented that showed that people are able to lose weight, but almost everyone gains it back long term. So they were approaching it from, and how do we intervene, like how do we change this thing that always happens.
Yeah.
Whereas, the health at every size research that I was learning about and the folks I was talking to, it was the same findings. People can lose weight short term, but, almost everybody gains it back long term. But instead of continuing to try to find some way when nothing has worked before of trying to, change this consistent outcome, they more accepted the outcome and said, okay, so this is what happens. Instead of continuing to hit our head against the wall and try to do something different, like what can we do if we accept that this is the outcome? How can we work with folks to help them have, feel better about themselves, be healthier, if improving health is a goal. So it just made a ton of sense. Yeah, and really I kind of switched gears.
Yeah, it sounds like in the quote unquote obesity research circle that you were in, they were like, yeah, people keep gaining weight back and that's their fault. Like what can we do to get these people to have more discipline? Whereas in the health at every size paradigm, it's like people keep gaining weight back. What can we do as providers to stop recommending this thing that's just going to keep people stuck and like you said, bashing their head against the wall?
Yeah, it was very much, the perspective of, okay, this isn't working. How can we change that? How can we make it work? And there is a lot of blame on the individual, and there's also a lot of like just throwing spaghetti at the wall of what interventions could we possibly do to try to change this really consistent outcome. And it just
Mhm.
made so much more sense to me to accept that this is what happens and what are the things that we can change to, to actually help people.
Yeah. I had sort of a similar experience with like the two different worlds at the same time. My first job as a dietitian was at Lenox Hill Hospital as a clinical dietitian. And they put me, I was just like the lowest of the totem pole new dietitian. They put me on the bariatric floor. And I already knew I was interested in intuitive eating. And it was just like a temporary job to try to get my practice started until I felt like stable enough to leave. So I was on the bariatric floor by day and then like doing the certified intuitive eating counselor training at night. And it was just like so interesting. I remember a big thing that stuck out to me was seeing in patients' charts how often it would say like the patient is back for a repeat gastric sleeve after they already had one and already had a lap band. And same thoughts of like, yeah, because it doesn't work. Like it's not long term. So I really like relate to that feeling, but also can see the value in being exposed to those different perspectives, like almost at the same time.
Yeah, it was a really valuable experience. I feel like I learned a lot about research and how, especially about how the same results can be seen through many different lenses. And I also spent a lot of time around the same period working in bariatrics and did my training there. And I think that that's training that I really value now because I have continually worked with people before and after bariatric surgery in my private practice from a weight inclusive lens. And now I think there's so much of that that also applies to what we're seeing with the GLP-1 medications.
Totally, totally. And I want to talk about that in a little bit. Yeah, I'm grateful for the time at Lenox Hill on the bariatric floor because one thing I just always I can just feel is the way that, I would walk into a patient's room like in a white coat and just like how patients often seem to feel like on the defense of like trying to justify everything they were doing, and just seeing that dynamic in the medical system of the person in the white coat is like gonna wag their finger at you and tell you everything you're doing wrong. So yeah, I mean I always hoped to not come across that way, but just witnessing how that was sort of the default of people's disposition in relation to medical providers, it just really stuck with me.
Yeah, that's definitely, so many things that I wish we could change in the medical system.
Totally, totally. Okay, so what was it like transitioning into integrating health at every size and the anti-diet paradigm into your practice as a psychologist?
Yeah, so I mean, I feel very fortunate that I found it early in my career. I think, in my first year of private practice when I started that, when I went to that retreat. And it was a process for me. Like I said, it didn't change overnight. That seed was planted. And it took me like years to really fully transition to, I think there was a time like so many of us, I was kind of in a middle ground around, um, kind of being weight inclusive, but also kind of still not. And there's a lot of unlearning and unpacking of biases, of, so much that we've learned and internalized. It was a slow process for me. And I think that made it, yeah, I guess, easier in a way to transition with my clients, because I don't think it wasn't like I was talking about, how to reduce calories one day and the next I'm like, love your body at any size.
Mhm.
It was a slow process. So I don't think it was like notable.
What do you think about the field of obesity medicine at this point in your career?
It's complicated. I think that one thing I would love to see is to get all the industry money out of it and to see where things really shake out. I think that there's so much similarities. Like I said, like I think that a lot of so I think there's a lot of industry involvement, a lot of people in it for financial gain, and I think that's problematic, like industries. And I think there's a lot of doctors and therapists and professionals on the ground who truly do want to help people. And there's a lot of folks who also see that telling people to eat less and exercise more, which had been kind of the age-old advice for many, many decades, does not work. So, I have mixed feelings. I think that there's a lot of commonalities and there's a lot of obviously very key places where the fields diverge. And we, I think have become very siloed in that. Like,
Hmm.
the eating disorder field by and large feels obesity medicine is bad.
Hmm.
And then, I don't know so much what obesity medicine thinks of us anymore. But I think, I don't know. I wish that I think there's a lot of nuance and bridges to be built in education, and, for people who truly do have the goal of wanting to help improve patients' lives. I don't think there's like one path that everyone has to follow to get there.
Yeah. Yeah, it's interesting to think about. I feel like a big start in bridging the two like siloed communities, the health at every size community and the obesity medicine community. I feel like a big start, at least for the health at every size providers, would be changing the name. Like obesity is just so stigmatizing, and often in health at every size communities, we don't even say that word. So like how can we recognize that whole community, that like you're saying, some people, some of the providers really do have good intentions, if like I feel like the name, at least for me, really causes me to shut down when I even hear like somebody has that in their credentials or something. I'm like, oh, but like what does that mean about you if you like feel like someone's body size is means they're sick automatically?
Yeah, I agree completely. I think it's very, and I don't want to minimize, there's a lot that's incredibly problematic,
Hmm.
about the way that whole field and industry is oriented essentially around weight loss.
Right. Yeah. Okay, so I dug up a very old blog post of yours. I don't even know how I got to it, but I did. And the post is called "Working from a Weight Inclusive Perspective with Clients Who Want to Lose Weight." Do you even recall this? It wasn't on your blog, it was someone else's site. But
Yeah, I think so. I think I wrote that for the Center for Mindful Eating. Is that
I
where you
think
got
that's right.
it? Yeah,
Yeah.
that was a few years ago. Yeah.
So I guess it's not very old, but it feels very old in that things have changed so much with GLP-1s now. So in the post, you talk about holding contradicting desires. So acknowledging clients' desire to lose weight while resisting prescribing weight loss as a provider. I'd love to hear you speak on how to navigate that tension in real time, like either I mean, I guess probably the listeners of this show aren't providers, they're people who struggle with this. So as a person trying to balance those feelings of like I don't want to go down the road of intentional weight loss and I can't help that I do want to lose weight. And then sort of part two to the question is how has this tension evolved with the popularity of GLP-1s?
Yeah, so I think it's very, very tricky. And I think that in our culture, so often people say, well, I want to lose weight, and it's met with, great, try this. Have you done this diet plan? Have you done that diet plan? And I think as providers, especially weight inclusive providers, there's a very kind of artful balance of holding space for validating people's feelings of wanting to lose weight. Like it makes a lot of sense that people want to lose weight in a culture that tells us every which way that it's better to be thinner, right? So we all live in that, we have all internalized those messages. And I think it can be really powerful to learn about the systems that taught us those messages, the profit that people make on us believing that our body is only acceptable if we're thin or smaller. Um, and having compassion for ourselves around wanting to lose weight, but also holding on to the knowledge that you know, pursuing intentional weight loss is not necessary. If you don't want to actually, if there's a part of you that doesn't want to pursue it, holding on to that part and, finding kind of coming back to like what really is best for me in this moment. What do I need?
Mhm. Yeah. Yeah, the first piece, I love what you said so much. Like, of course you want to lose weight, right? Like you're not making this up. Weight stigma is real. Like additional power and privileges really are afforded to people in smaller bodies. Like, of course you feel this way. And if you're also valuing like your like health long term or inner peace and all these other things, then it isn't a road most of the time that will lead to that destination.
Exactly. And I, as a therapist, spend a lot of time with folks who want to lose weight. I would say, a lot of the people, if not most, who come into my practice want to lose weight.
Yeah.
And I spend a lot of time trying to understand why, what's behind that, what are their goals really about. And I think that from there, so often we tie things with weight loss that aren't really about weight loss. So, what do you want to do? Why do you want to lose weight? Is it improved mobility? Is it improved acceptance, desirability? Just feeling like you're wanting to be healthier, so like, can we kind of really parse out those goals and then separate out, like, are there things we can work on now? Are there things that are, so often when people say they want to lose weight, what they really want is alleviation of weight-based stigma and discrimination. And unfortunately, that's not something we have a tremendous amount of control over. But even just recognizing, those things are societal problems, they're not a problem with your body, can
Mm.
provide some resiliency to be able to go out there and kind of cope with what comes your way. And it's all really hard.
Yeah.
It's not an easy process.
Right. I appreciate you bringing that up because I think the route of what's underneath the desire for weight loss sometimes is simple. It's like, oh, I'm craving more connection or like more spontaneity. Or once I had a client and she was on the beach and she saw another couple and they were like super ripped and like, just like Instagram couple vibes, like an Instagram influencer. And she was like, oh, like I want to look like them. Like, why don't me and my boyfriend look like them? And through, speaking about it, like what would you have if you looked like them? She's like, oh, we'd have like a more passionate sex life. And I'm like, maybe, but like also like you're saying, could you go right to that and not have your body changing or having a six pack be the intermediate? But what you're bringing up of like sometimes it's you can really go right towards the source of the wine, but when it's like changing society to not feel othered all the time, it's such a more difficult piece to address.
Yeah, yeah, that's one of the hardest things. It's like, I wish I could wave a magic wand and say that'll be better, but we can't. And it's something that people have to live with. Which is why I think body autonomy plays such a huge role in all of these conversations too.
Can you share more about what you mean by that?
I think that it's easy for us to, as, weight inclusive therapists, and I see this a lot in kind of the eating disorder recovery community and in the health at every size community, to kind of think in all or nones, to, say, well, I've even gotten pushback that I work with people who've had bariatric surgery, or to say that, if you're on a GLP-1, that's bad, like I can't work with you, or we should always be saying that, taking GLP-1s for weight loss is bad and whatever. Like I think that these are such intensely personal decisions, and I'm not living in anyone else's body. And I think body autonomy comes down to the idea that, we each have the right to do what we want with our own body as long as we're not harming anyone else. And as a therapist, I really see it as my role to help clients be informed about the choices that they make. So, what are the realistic, expectations from something like bariatric surgery or GLP-1 medication? Helping them advocate to their doctors for, for example, if you're wanting to take a GLP-1 medication because your doctor's saying that's the only way that you can be healthy. Okay, let's go back and look at, like if there was someone who was in a thinner body, what might they be recommending?
Right.
Or what are other different options? And work through all the emotions around it with my clients. And at the end of the day, it's their choice. It's a very personal choice. And I don't think anyone who's not living in their body can really make that.
Mhm. Yeah, it's such an important point. I just want to share, and I'm sharing this with permission because she has already come on my podcast. But when I lived in Brooklyn, like I mentioned, I lived with one of my best friends from Jewish summer camp, and she lives in a larger body. And when we were living together, she decided to start going on a GLP-1, and she knew about intuitive eating deeply, obviously, like she lived with me, and she also worked with an intuitive eating dietitian herself. And it was such a moment for me to really challenge this black and white thinking like you're sharing of like this is always bad and like oh my gosh, like this means bad things, and really try and understand like what it feels like to navigate the world in the body that she has. I mean, I don't know. I can only like listen and hear what she has to say about it and try and the best I can support her instead of shame her when she's already experiencing so much shame. She was on my podcast. It's our most downloaded episode by like thousands. Hearing her talk through her decision to go on and what it was like for us, like living together and this back and forth. And it was like, it was the beginning of GLP-1s too. It was like, oh, this thing, I feel like the pushback in the anti-diet community was especially loud at the beginning. And I like, it was like in my fridge. Like I saw it every morning. It was just a wild thing to grapple with. In the end, after being on it for a few months, she made the decision herself. She didn't like how it made her feel. She's super smart. Like she noticed come Sunday night when the dose was wearing off because she would take it on Mondays, she felt bingy. Like she felt really hungry and she could see, oh, I want to have a kid one day. If I go off this for that, then like it's going to be these feelings of increased hunger and times a million when you're off the shot, and she could just see that path of weight cycling ahead of her. So she ultimately decided to go off of it. But that was just such a moment in my career where I'm like, oh, I like when you're seeing it so closely with someone you love, it's like, of course she wants to feel comfortable and yeah.
Yeah, and I think that so much of that is the like informed consent piece. I think that there's so much misinformation out there on GLP-1 medications and a real understanding of like the side effects of the idea that people are going to need, it's recommended that people stay on the medications long term, that most people will regain the weight if they go off the medications. I think these, like I think that as professionals and clinicians, and I hope, especially for medical doctors, there's an obligation to help share that information so that people can really make informed choices, and are they, are those risks worth it to them? And that's the piece that I think is personal, is what risks are people willing to take and how much urgency is there?
Absolutely. You got into this a little bit, like the what's underneath the desire for weight loss and trying to explore that with a client. But more specifically, when someone says something like, I just feel better when I was X pounds lighter or when I was smaller, what do you find might be underneath this feeling?
So I think it's different for everyone. And, again, trying to ask and understand. But, oftentimes it is things like I felt more accepted, I felt more confident, I felt I was able to do more things, I was able to have more access to things. I was looked at differently in the world. I felt more desirable, I felt more valuable. People listened when I spoke. Yeah, it's a lot of things. And I think, again, trying to unpack, okay, like what are the things that could, be done now, right? So like, okay, you're wanting more mobility, maybe like going to physical therapy, maybe starting to be more active in ways that are, work with your body now. And also accepting some of the cruelties of the world that people are seeing differently in a smaller body.
Mhm. Yeah, yeah. I want to talk a little bit about your husband. He was on the show, I think like a year ago, maybe a little more, talking about the like non-diet approaches to blood sugar control and debunking a lot of myths in that area. I'm so interested in your story. I think I asked him the same thing. It was a year ago, so I don't fully remember, but if I remember correctly, you found this world of anti-diet health at every size first, and then having a partner in the medical community shared it with him, and then it eventually impacted his practice and his work. I'm curious what that dynamic was like and how you learned from each other's expertise.
Yeah, so it was a slow process. It was a slow process for me, and he was really, we've been together for, what is it, 17 plus years now. So we've really kind of, when we met, I was still in grad school, he was in medical school. We've evolved a lot of our careers together, and we both started off very focused. Well, he was, just doing more general endocrine, but there's a big overlap with kind of weight stuff in endocrine. I think it's honestly one of the most um, kind of weight centric fields of medicine in an entire weight centric industry of medicine. Um, and I was working in obesity research. So there was a lot of overlap to the work we were doing. And when I first started learning about health at every size, I started sharing this with him. And, he's kind of like, well, like, where are the studies? What's the evidence? And I would bring through some of the studies, and we'd kind of look through some stuff together. And, that wasn't the research, I don't think was particularly compelling at that time, to be honest. There were one or two studies out there that weren't published in the most prestigious journals, which is, something that academics tend to look at. But over time, I became more and more involved in it and shared more and more, and his perspective started to shift a little bit. But it took, again, many, many years and conversations for him to really fully come over to the weight inclusive side. And he always says that the thing that was very convincing for him was when in 2020, when we were kind of holed up together, and I was writing my book, and I would ask him to review, chapters as I was writing it, and what do you think? And is this all accurate about diabetes or whatnot? And he was reading kind of this like intense compilation of a lot of at that by that point there was a lot of research that was out there, not just about health at every size, but a lot of the research from the obesity research community with the results just interpreted through a weight inclusive lens.
Mhm.
Um,
Yeah.
so, he always says that like reading my book and seeing all of the research like laid out like that was really the thing that fully kind of brought the other foot into the weight inclusive
Well,
lens.
what an awesome plug for your book. Like it brought your doctor husband to the other side. And so full circle that he had that experience with like the obesity research, but being interpreted from the health at every size lens, like in the beginning of your career, your realization of like, this is the same research, just interpreted differently.
I think it's really powerful. I mean, I think some of the most convincing research for weight inclusive lens comes from the obesity research community.
Yes, that's so true. I never thought of it like that. But what about the people who are oh, but like we could just interpret it in the weight normative way and like the way that the obesity papers are intending it for it to be interpreted. People who are committed to misunderstanding and not being open are always gonna find something like that to say. But what are your thoughts on sort of the rebuttal of like, oh, but like it's just being skewed by the way it's being interpreted?
Well, I mean, we would hope research isn't so subjective, but I think sometimes when you read a research article and you read the results of a study and you read the conclusion section or the discussion section, I'm like, is this the same study? Is this the same paper that they're talking about? I think a lot hinges on how you define success. A lot of studies, if people lose, I think it was initially like 15% of excess weight, and then people weren't obtaining that. So then it's, 10%, 5%, 3%. Like it's just the bar keeps changing in terms of how you're defining success. And I think that like most people would feel that if you say there's an intervention that 90% of people, are not going to be helped by, that's not an incredibly effective
Yeah.
intervention. But there's lots of ways to look at the data and especially the follow-up. I think the biggest thing in most studies about weight is that it has very short follow-up periods. And, the weight loss industry knows that people can lose weight. I think that like people being able to lose weight for a short period of time is something most people who've struggled with their weight have experienced. And the issue is that, regain and the weight cycling, and there's some research that came out recently really showing a lot of the health impacts of weight cycling. And, and then of course, like the fact that people deserve to be treated with dignity and respect and access to healthcare, regardless of their weight and their health. But yeah, there's just a lot of looking at the data through a very specific lens. And yes, we're looking at it through our own specific lens as well. And, people can kind of read both and see what resonates and
Right.
what feels true. I mean, I think for most people, the most important thing is your own lived experience. For people who've struggled with their weight, for people who've struggled with chronic dieting, who are in recovery even from eating disorders, when I say, well, like, how has that been working for you? Right?
Yes.
Like
Yes.
sometimes people try to debate, well, like, I think that, dieting is really what I should be doing. I'm like, okay, then you don't, they don't, there's something that brought you to my office. There's something that is drawing people to listen to your show. And that is that most often that what they have been doing with the traditional diet model, pursuing weight loss again and again, and the self-blame has not been working. And honestly, I think that is much more powerful than any research study could ever be.
Yes, I love that so much. My favorite professor from undergrad, who's been on the show twice, she's, PhD in nutrition, registered dietitian, and she said this line that I'll really never forget. She said, research is just one way of knowing, and like we often value it as like higher than stories and lived experience. But like you can get in the weeds and argue about the studies and how they're interpreted all day long, but like look at your own life. How has it felt to diet? How long has it been sustainable for you? And I think that's such a powerful reframe.
Yeah, we know.
Yeah, we
I
do
mean,
know.
so much, in therapy, so much of the work we do is helping people trust themselves again.
Right. Yeah. Yeah. It's like they're not like learning anything new, but like excavating what's already inside of them.
Yeah, exactly.
Yeah. Okay. This is me going off script and asking you something that I just became curious about as I'm learning about you. Do you ever navigate, as I'm asking this, I'm like, I'm sure you do, parents of children's friends or situations where like your children are out in the world hearing dieting messaging, weight normative messaging, and bringing that home? And yeah, what are your advice for parents navigating that?
Yeah, it's amazing how much of it is still out there. I mean, I don't know why I'm surprised, but when I first had kids, it was such a time where I don't know, it felt like things were changing a lot in the field, right? Like I had my daughter, my older daughter is 10 now as we're reporting this. And um it was a time where like body positivity had really kind of like blown up and a lot of even like mainstream spaces. We were seeing plus size models on the cover of Vogue magazine, and there was like just felt like there was a lot of change happening um, in this space and in a lot of other spaces too around acceptance and inclusivity. And I was like, this is so awesome. My kids are gonna like be whoever they want to be, and they're not gonna grow up with all this baggage that I had around our bodies and weight. And you know, it blows my mind that it's kids are still getting the same incredibly harmful messages as we were, which was really disappointing. Obviously, we have tried to raise our kids in a very kind of, fat positive home. It's something that my husband and I, very much feel passionately about. We have tried to raise them with intuitive eating, with trust around their body, without restricting, food. Of course, there are moments where our own stuff comes up. We're not perfect by any means, but that's our intention in raising our kids. And, my older daughter, who is at an age where we're very influenced by peers, and, mom and dad can say one thing at home, and she goes out and is still internalizing messages around that it's better to be thin. Um, and it's really challenging. It's very challenging. We try to control as much of it as we can in terms of how we talk about bodies in our home, how we talk about food in our home, people that we can try to ask, to tone it down, like family members, things
Yeah.
like that. But at the end of the day, the kids are going out there into diet culture and they're going to internalize. And the only thing, the most that I can hope for as a parent is that we are doing enough foundational work at home that my kids have some resiliency to go out there and to know that they are good enough, whatever their
Mhm.
body size is, and this isn't what defines them.
Yeah, this moment where things seem so hopeful. I remember that moment too, and then it's like swung in the other direction with like,
Mhm.
oh, this awful term, heroin chic being
Mhm.
in, and of course, TikTok and all that probably plays a role. Yeah, I'm not in that season of life yet, but I can only imagine like how much you want to protect them and how much is just truly out of your control.
Yeah, well, and that's the thing about parenting.
Yeah, I'll be my own journey one day. My anxiety will love that. Okay, my last question before I ask you two questions that I ask everyone. Any tips for someone who's looking for a non-diet, HAES-affirming therapist, specifically therapist? I feel like with dietitians, it's more like you lead with it more because it's like it's more directly related, obviously, to food. But sometimes like I have a client looking for a therapist, and I think there are a lot of therapists that don't like necessarily have that in their bio. That would be the easiest way. But yeah, any tips for figuring out a therapist that will be aligned with the work instead of like causing friction against the work?
Yeah. So, first of all, I'll give a little plug for my practice. We're based in New
Please
York
do.
City, but we treat people in New York, Florida, Vermont, Connecticut, and we have a PsyPac therapist as well who treats folks in a whole bunch of different states. So you could start with
Awesome.
us.
Yes, love it.
Conason Psychological Services. But in terms of like how to find, how to kind of suss out if someone is weight inclusive or not, the best thing is a referral, like from someone that you trust. And the second best thing I think would be, yeah, looking at people's websites. Are they using language like weight inclusivity, fat positive, health at every size, body neutral?
Yeah.
There's some of the terms that you would want to look out for. Anti-diet is another one you might see. But just because someone has those things on their website doesn't even mean they really understand what those terms mean or that they practice from that point of view. Yeah, so I think it's just kind of like having to suss it out, asking questions. Most therapists, a lot of therapists do offer like a preliminary phone call to try to understand. So you can say, what is your take on weight? Do you encourage weight loss? Do you support weight loss? How would you work with a client who wanted to lose weight? Those kinds of questions can be helpful.
Mm. This is not like an exact science. but I just want to, for what it's worth, add sometimes I see things on therapist profiles like I believe food is medicine, or like I take a whole person approach, and part of that is your diet or something. And not that that always means that they're gonna be like take a restrictive diety approach, but I have found sometimes it just like because they're like leading with that, I have had clients come back and say like they tried to tell me that like my anxiety was related to processed food or something. So I don't know if it's not to say you see that and that's automatically a therapist that isn't going to be aligned, but maybe it's like a little bit of sets your spidey senses off and something to investigate further.
Exactly, yeah. Like I think some of these things can be red flags. I also would be very cautious about anybody who treats eating disorders and, does weight loss or recommends weight loss on their website. Those are some more red flags. So again, like, you do your investigation, you can have questions to ask, how familiar are you with weight inclusive approaches? Tell me how you work. Those are some questions that most therapists should feel comfortable answering.
Yeah. Oh yeah. When you see like the bullets of specialties and it's like eating disorders, weight loss, it's like
Mhm.
okay.
Right.
Um, okay, I'm gonna ask you two questions that that I love to ask everyone who comes on the show. And the first is, what is your biggest diet culture pet peeve
Hmm.
right now, like in this current moment?
In this current moment, I mean, GLP-1s for everything. And I think GLP-1s have a place, like they're great medications for treating diabetes. Again, personal autonomy, but the way that our culture, that diet culture talks about GLP-1s and the way that it has really shifted the whole conversation around like body acceptance, and it's just yeah, like the Ozempic era. I would say
Yeah,
that is my pet peeve right now.
totally. Yes. I'm seeing these targeted ads on YouTube now that's like they're trying to like make it appeal to like the branding to like millennials. It's like have you seen this hers?
Hmm.
And it's like it reminds me of that dentist I used to always see in New York tend like just like simple one word like clean,
Hmm.
font and branding. The fact that it's like making its way, it's like I mean, I think we're past this. It's like way out of the doctor's offices and like into the media and marketing. Feels
Yeah,
like scary.
yeah, in New York, I'm seeing all of these little kind of vacant spots that had like the pop-up COVID testing places, or like now they're all pop-up Ozempic prescription places.
Oh, that's wild.
Yeah.
Wow. That's wild. Okay, my last question that I ask everyone is I'm a certified intuitive eating counselor. I think, not being in the diet world, it's like, okay, well then how do we eat? We listen to our body, our intuition. When I started this podcast, I got really curious about the word intuition. It just feels so big. And so I like to ask guests, what does intuition mean to you and how do you experience it?
Mm. So intuition to me is about a deep sense of trust in yourself. And I experience it by, I guess, tuning inwards. I think that so many of us become like disconnected from ourselves. I should say I work a lot with mindfulness in my therapy practice, and I'm a big proponent of mindfulness. And I think that one of the things that mindfulness can has helped me personally do is to slow down and check in with myself. I think that I tend to be and for so many of us, we're like very busy. We're always going. We're just like always thinking about the next thing. And we often don't take the time to really understand like what do we need? What are we feeling? What are we experiencing? And I think that's intuition. Intuition is everything from like our gut kind of saying like this interaction doesn't feel quite right, or like something feels a little icky about this, to like our body telling us I'm hungry, or I'm really in the mood for a ice cream sundae right now, or I'm in the mood for a big kale salad right now. Like it's all the information that our body and the wisdom that our body gives us. And if we can just kind of trust that, to me, that's intuition. That's going with our intuition.
It's beautiful. I love it. Is there anything else that we missed? Anything else on your heart that you're feeling called to share with the people?
No, I mean, I think we covered a lot of it. This was a really great conversation. I'll, in addition to a plug for my practice, just mention my book, The Diet-Free Revolution.
Yeah.
Um, I think that my intention in writing the book was really to help give people a lot of the tools that I have found to be really helpful in the decade plus that I've been working with clients around issues like binge eating, binge, yeah, diet restrict cycles, diet binge cycles, all that stuff. I do think that while everyone is unique, there are a few tools that have been really helpful consistently to help people get out of diet culture and more in tune with our bodies. So I put all of that in the book, and I hope it's helpful to folks.
Yes. Okay. And where can people find you to stay connected, learn more about you, your practice, the book, if you can just repeat that so people have it.
Yeah, so I'm most active on Instagram. I'm at the Anti-Diet Plan. My website for therapy is Conason Psychological Services. My website where you can find about my book and my coaching services. I offer supervision and consultation for eating disorder professionals as well. That's all at drconason.com, Dr. Conason, Conason.com. And my book, The Diet-Free Revolution, 10 Steps to Free Yourself from the Diet Cycle with Mindful Eating and Radical Self-Acceptance, is available wherever books are sold.
Amazing. We'll put all the links for those things in the show notes. Thank
Great.
you, Alexis. So nice connecting.
Yeah, so nice.